Hello friends, welcome to the show Talk with Your Doc. I'm Dr. Prashant, and our guest for today is Dr. Hazem Elmansy. He is a urologist, he's associate professor, and he is one of the most important pioneer surgeons in northwestern Ontario. He has performed a modern, most latest prostate enucleation surgery. So we are going to talk about that pioneering surgery he has done here today, as well as we are going to talk about one of the most common entity, which is benign prostate enlargement, which is seen in about 30 to 40% of the man after the age of 50 years. And it is even though it is not dangerous, it is a bothersome condition, and which is very common. So Dr. Hazem Elmansy is here to guide us. Thank you, Dr. Elmansy, for your time.
Thank you so much for the opportunity, and I'm really excited and happy to be with you today.
Please tell us about the surgery which is unique you are performing in northwestern Ontario.
I think we started this surgery. My fellowship was in Indiana University, so from where I brought here the holmium laser enucleation of the prostate.
What is it called?
Holmium laser.
Holmium laser.
Enucleation of the prostate. We call it HOLEP, H-O-L-E-P.
HOLEP.
Yes.
HOLEP. It's a laser surgery for
laser
the prostate
surgery
gland.
for any size prostate, but specifically for very, very large prostate. That used to be traditionally done by open surgery in the past, but now replaced by this unique technique.
And you are the only surgeon in Ontario, probably?
I'm the only surgeon in Ontario.
And in Canada, probably?
No, well, this procedure was done in Montreal since 2000, and is still in Montreal until now, but the second site now in Canada is Ontario. So we started this in October 2017.
So we'll talk more about this most advanced procedure you're doing here. But tell us something about prostate enlargement. How commonly you see those type of patients in your practice?
Most of my practice actually is for prostate in general, and specifically for the benign enlargement of the prostate.
So what is this benign enlargement of prostate? What it presents with?
So first of all, every man has a prostate, but at the age of, starting from the age of 50-year-old, the part of the prostate gland start to get larger, and it's part of the aging process. Some people is not going to have any symptoms, but other patients will have severe symptoms and a lot of complications.
When you say severe symptoms, what does it mean? Like, what happens?
They start first with some weak stream. They need sometimes to push hard to pee, wake up at night many times to pee, sometimes have frequency for urination, the urge to go. And most of the symptoms sometimes affect their quality of life and have some other symptoms.
So to get up in the middle of the night and they want to go for the urination, but they can't pass the urine?
Yeah, with difficulty to
It's
pass
like
the
obstruction
urine. Yes,
because of
exactly. Like there is a blockage. This gland get larger. Usually it's the size of the walnut, but after the age of 50 can get larger, like an orange or bigger even.
Wow. So it's common after age 40, 50 years of age.
That's correct. That's correct.
So what does it cause? What is the cause behind it gland increasing after a certain age?
So the answer actually we do not really know.
Nobody knows.
No research figure out what is the cause exactly. There is some research regarding some hormonal changes that happens to the body for a man after the age of 50.
So what is that hormone like which causes enlargement?
It's called the testosterone hormone. There is imbalance between the testosterone pathways that makes the prostate get larger.
So more amount of testosterone causes?
It's just discrepancy between certain types of the testosterone and some the other one is called dihydrotestosterone.
Is there any predisposition of genetic factors or familial predisposition?
Well, could be for the prostate cancer, yes, the answer, there is some family history related, but for the benign prostatic or the benign enlargement of the prostate, we do not really think there is really family history. I cannot really say these family have larger glands bigger than the other families.
I've heard that some patients who are obese, they have high risk for the benign enlargement of prostate. Is that true?
Well, this is, one of the theories. Some people can talk about diet, obesity, lifestyle, but there is no really proof or any research really supported 100%.
But if you modify the lifestyle, is it possible?
If you modify the lifestyle, because the first option, always when we talk about with the patient about management, I really look into his lifestyle before I jump into medication or offer surgery. Lifestyle could be exercise, reduce coffee, fluid, manage the fluid intake. Sometimes I look in his medication list, modify with the help of the family doctors some medication that makes him pee more sometimes. It does help sometimes.
So after age 50, should everybody get tested for enlargement of prostate, or when do you see a urologist?
He goes usually to his family doctor, and most of the family doctor, they are comfortable with the initial management, talking about the lifestyle modification. They are comfortable to give some medications. And the majority of our patients in general respond well to medications. Some of the patients who are not responding very well got referral for urologists, so we can add more medications or modify some medications, or we offer some minimally invasive options.
So what happens if one does not go to a doctor, doesn't take a treatment? What happens?
So there's two options might happen, two things might happen. So the first thing, he might suffering from a lot of symptoms affecting quality of life, and some patients say, well, it really bothered me, but I don't want to take medications, or I don't want to take or to be having any surgeries. But there is other complications might happen that the patient is not aware of. For example, this blockage might increase over time and block his bladder, have very large bladder capacity. Patient now is exposed to many urinary tract infections, blocking both kidneys, start to have kidney failure or deterioration of his kidney function, that it's going to be late to be discovered. And the outcomes, is not going to be the same if you compare it to the patient who presented himself early in the disease. Yeah.
Right. So is this benign enlargement of prostate, does it cause a cancer?
The benign enlargement of the prostate is not related to prostate cancer. And just to add, my laser technology as well is only for the benign part of the prostate,
Not
is
for
not
the
for the
cancer.
prostate cancer. Prostate cancer, there's other more different options to treat it.
Right. So as you said, it is not cancer. It doesn't lead to the cancer. It's
It
a
doesn't-
benign condition.
It is benign condition and does not lead to any cancer. But usually we advise the patient who have symptoms to be screened for prostate cancer by doing physical exam with the urologist or with family doctor, and do a blood test, special blood test called PSA.
We'll take a short break and we'll come back to the PSA test after the
Thank
short
you.
break. Please stay back for the next part. Thank you. Welcome back to the show Talk with Your Doc, and our guest for today is Dr. Hazem Elmansy, and we are talking about benign enlargement of prostate, which is very common. Dr. Elmansy, you were mentioning about investigation, and one of the investigations you mentioned is PSA.
Yeah.
So what is PSA?
PSA, it's a blood test. We start to do it at the age of 40 or 50-year-old, depends on a lot of risk factors for the patient. It can give me an idea if the patient need further investigations to make sure that he has prostate cancer or not. So there is certain cutoff, depends on different age groups. Once I have a concern of if the patient has elevated PSA, the next step, maybe I will repeat it one more time. And if it's still persistently elevated, I will direct the patient to more options to verify if there is a prostate cancer or not.
So PSA is a blood test,
It's a blood test, yes.
and it is like a screening test for the cancer, probably?
It's a screening test for prostate cancer.
Prostate cancer. So after what age one should get the PSA test done?
It depends on which guidelines we are following, but in Canada here, we usually start at the age of 50. But if the patient has some risk factors, we can start 5 or 10 years earlier, around 40 or 45-year-old.
So we get a blood test done after age 50 every year or every 2 year? Or?
So that's a very good question, actually. It depends on your initial results. So if your initial results less than 1, we can do it every 2 years. If it is more than 1, we can do it every year. If it is really at the borderlines, we can repeat it every 3 to 6 months.
So the normal level is 1, you said?
No, I mean, the normal level is in most of the age groups or certain age group around 50 to 60. Like we prefer less than 4. This is our normal or safe range.
Okay. And then once the the levels are elevated, does that mean patient has cancer or there are other reasons for the elevated PSA?
There is a lot of reasons for elevated PSA. It's called prostatic specific antigen, but actually it's not specific.
Okay.
Can be increased in benign prostatic enlargement or the benign enlargement of the prostate, or any infection of the prostate, any inflammation of the prostate as well can cause false elevation of the PSA. For that reason, we do not really jump to more invasive tests. We like to repeat the PSA first. One
So
more time.
high PSA doesn't mean that you have a cancer. One should not get scared about it.
Exactly. Like,
It can be a benign condition also.
I know sometimes elevated PSA can cause anxiety to our patients, so we always reassure them and that it doesn't mean cancer, and we will repeat it. And even when repeated is still high, there is other option to prove cancer before we go to the next step.
So other than the PSA, what are the other investigations which are recommended for the patients with enlarged prostate gland?
The most important thing, is talking to the patient, asking him questions. And one of the magic word we use is the bother symptoms. Because the patient, if you have a lot of symptoms that does not bother him or does not affect his quality of life, I would not even give him medications.
Okay.
For the first thing we do is we listen to the patient carefully. What is his concern? What is his expectations from me? And what is the degree of bother? The second thing is we do urine analysis just to make sure there is no infection, because symptoms of the benign enlargement of the prostate and infections overlap.
Oh, they
so
look
with simple
similar.
test, patient might have some infection and we can give him some antibiotic for a couple of days and that's it. He doesn't have doesn't have to take medication for his prostate. And after that, there's another test we might add, which is a flow test. I always invite the patient to come to the hospital to void on a special machine to make sure if there is any blockage in his bladder and to make sure how good he's emptying his bladder. We have a lot of patients say, I empty my bladder very well. Surprisingly, when he comes to the hospital, when we do this test, they have a lot of amount of urine inside the bladder they were not aware of.
Is there any radiological test to detect enlarged prostate?
There is ultrasound or any kind of imaging or the camera to make sure if the prostate is really enlarged and what's the size of the prostate now for the patient.
So once patient comes to your office, you first talk to them and then get a urine test done, PSA test done, and then voided urine examination test.
Correct.
If required, you do ultrasound.
Exactly.
Do you ever do any invasive tests in the patient, like biopsy or anything?
That's a very good question. I mean, biopsy has certain indications. If the patient have elevated PSA, persistent elevated PSA, we'll do biopsy. If the patient has blood in the urine, I have to do kind of a camera to make sure there is no bladder tumor. Large prostate can cause blood in the urine, but I need to make sure by the camera to make sure there is no bladder tumors. If the patient has some difficult symptoms like cannot be justified by a large prostate, numbness in his hand or difficulty walking, sometimes we can do urodynamics to make sure, which is a test like the test for the heart, the electrical activity of the heart, to measure what's the pressure inside the bladder, or does this patient well benefit from medication for the prostate or surgery or not.
So once the patient is diagnosed with enlarged prostate with all these investigations, what you just mentioned, what is the next step now?
Next step is I will tell him what is your expectation from me. We can start with very simple things like lifestyle modifications, modify your fluid intake, decrease coffee intake, and we can start it for 6 weeks. And after that, if the patient is still not happy, there is a lot of medications we can offer. And remember, every medications come with special side effects. So sometimes the side effects bother the patient more than the symptoms. So I would like to make it clear about the expectation and give the patient the time and the proper counseling about the medication, what is the long-term effect of this medication, and what are the side effects.
So medications, does patient has to take this lifelong or for certain time, and what are these medications we are talking about?
So we have like more than one class of medications. So most of the medication we give it for the lifelong. There is some patient that are not going to respond from the medication from the beginning, and other patient will have a good response for the rest of their lives, and other patients gonna have initial good response, and after that they may deteriorate at the end.
So medications do help to certain patients, not all the patients. Probably.
Majority of the patient, it helps in the majority of the patients, yes.
Okay. We'll take a short break and we'll continue our discussion, and we'll talk about surgery now,
Okay.
which is very interesting part which you perform especially. So please stay back for the last part, and we'll talk about the minimally invasive surgery which Dr. Elmansy is specialist in. Thank you so much. Please stay back. Welcome back to the show, Talk with Your Doc. Our guest for today is Dr. Hazem Elmansy, and we are talking about benign enlargement of prostate and treatment options. Dr. Elmansy, you were mentioning about medications and it works in majority of the patients.
That's correct.
So then who gets the surgery?
So the patient who's not interested from the beginning in the medication, we have some patient, they said medications is not for me, I would like just one procedure to be done and I'm done with my large prostate. Or the patients who was not doing well on the medication is not satisfied, or still there is some complications or progression of the symptoms going on.
So surgery, when you say, I think there is one open surgery and this is minimally invasive surgery you are doing. So please tell us, what is the first open surgery like?
So traditionally, before the era of the laser and the minimally invasive, we used to do a large size prostate by a big incision in the abdomen. Patient stay in the hospital for a week, catheter inside his body for a week, delayed returning to his normal activity, blood transfusions, infections, and now this all traditional open surgery replaced by the era of the minimally invasive technology of surgeries.
So nobody performs now the open surgery anymore?
Well, in Thunder Bay, no, because we are very advanced here. In other provinces and or other countries, when this technology and technique is not available, still open surgery is one of the options.
So what is this laser surgery, which is a minimally invasive surgery you are specialized in? Please tell us something about this surgery.
So there is different kind of lasers we have in Thunder Bay, like we have 3 lasers, and but for the holmium laser and the technique, and remember, it's not only the laser, it's the technique. I can apply laser to vaporize the prostate, to shrink it a little bit. If the prostate gland is less than 80 grams, like small to medium size prostate. When the prostate more than 80 grams, we need the enucleation technique using any kind of laser, but we have here the holmium laser we can do. And we think about the prostate this way, like an orange, has a skin and has a fruit. The skin represents the prostate that we're born with, and the fruit represent the prostate that enlarge with age and blocking the bladder. So we call it minimally invasive. So we go through natural opening. There is no opening, no incisions.
So through the urethra?
Through the urethra. And I peel off this fruit from the skin. I push it inside the bladder with another small machine called morcellator. It cut the orange or the enucleated prostate inside the bladder into small pieces and suck it out. Patient will have a catheter for a few hours, go home the same day.
Same day.
Most of my patients told me they have zero pain and
Oh.
they have early return to their work. And the good thing about this technique, the HOLIP, is the durability. This gland is not going to get large again, and the patient is not going to have again surgery for his benign prostate any.
Oh, this is the one-time surgery.
One-time surgery, but still the patient might have, he still have some small prostate, the part that he was born with, and he's not immune from having prostate cancer in the future. So I always focus and advise my patient that you still have a tiny prostate, you still need to see me every 1 to 2 years, I still need to do exam, I still need to do a PSA blood test on you.
So once you do this laser surgery, is there any complication associated with this laser surgery?
That's a very good question. I mean, if you go to any operating room, there is always a list
something.
of complications, but the complications risks are very minimal with this technology.
Like
But
say 1%?
1% bleeding, we say 1% infection, 3% scars in the urethra, 3% or 5% leakage when the patient cough or sneeze. But very important that the patient with any laser technology will lose his ejaculations, meaning with any laser technology or most of the medications of the prostate, the patient does not have any ejaculation, meaning there is no fluids coming out. So this is very important to counsel the patient about.
Now, does patient has to take any anesthesia during the surgery, this laser surgery?
For sure, the laser surgery, it's a surgery. Patients can have general anesthesia, completely sleeping, or he can have needle in his back, which is spinal or epidural anesthesia. And our anesthesia team here is very comfortable doing both.
And how long this surgery procedure lasts? Like?
That's a very good question. It depends on the size of the prostate.
Okay.
If the prostate around 100 gram usually takes me 1 hour, it's 400 or 500 gram can take like 3 or 4 hours.
But it's a outdoor, like outpatient procedure.
It's a day surgery.
It's a day
we
surgery.
do not keep the patients home for any laser surgery.
Wow, that's so interesting.
Yeah.
Yeah. Now, once the patient undergoes this laser surgery, he does not have to worry about, he has to come and see you a couple of years after just to follow up. And
I really like to stay in touch with my patient. I always advise them. The first year after the surgery, I like to see them every few months to make sure they are emptying their bladder very well, they are happy, there is no complications. And after that, I give the patient the option, would you like to see me once a year as part of a man health, or would you like to call me when you need me?
yes. Now, I heard that you started a fellowship program training other urologists across the Canada or any other country. They can come and get trained in this holmium surgery.
Yes, the holmium laser.
Holmium laser
Yeah.
surgery.
Yes.
So please tell us about your fellowship program.
So we started like 2 years ago, and this is the first NOSAM clinical fellowship. And my goal is to take 2 fellows per year, 1 Canadian and 1 international. We have a long waiting list from the international fellows to come to learn from us different techniques, not only the laser surgery. My colleague Dr. Sharur as well doing urethroplasty and a lot of great surgeries. And we graduate them as clinician, researchers, and leaders as well to go back to their countries or other provinces to try to help their patient and make their patient have a good access to this unique technology. And we already graduated 2 fellows so far, and actually they are doing great. They are making us very proud.
They're in Canada?
1 in Canada and the other one in overseas, and we have another 2 fellows now.
Nice. There might be a long waiting list for the surgeries also.
Exactly. So my goal is the next few years, more Canadian have access to this special technique, hopefully by graduating more Canadian fellows through NOSAM University.
Thank you, Dr. Elmansy, for coming and sharing your knowledge and realizations with us. Thank you so much.
Thank you so much for the interview.
Thank you for joining us. See you next time.